We are going to discuss the drug Diazepam, also known by its trade name Valium. This drug is part of the class benzodiazepine. These drugs work by enhancing the action of gamma-aminobutyric acid, GABA, in the central nervous system. Here's a demonstration of how that happens. Imagine the bottom of the screen is inside the neuron and the top of the screen is the extracellular space. In this space, there are a bunch of chlorine ions. GABA comes and binds to the receptor of this channel protein, allowing chlorine ions to go into the cell. With benzodiazepines, the benzodiazepine may bind to the benzodiazepine GABA complex, enhancing the effect that GABA has, allowing more chlorine ions to pass through that channel protein. These increased chlorine ions in the cell, because of the enhanced action of GABA in the CNS, allows for higher hyperpolarization of neurons, which leads to fewer excitations of the neurons. In low doses, this has a sedative effect, calming and soothing the patient. In higher doses, this has a hypnotic effect, inducing sleep in the patient. These drugs are a good candidate for anxiety disorders. Signs and symptoms of anxiety disorders include restlessness, tachycardia, which is increased heart rate, apprehension, poor concentration, and nervousness that lasts over 6 months.
Okay, so now we are going to look at the therapeutic effects. These include fewer panic episodes, increased ability to sleep at night, and shorter sleep induction time. With patient teaching, we are going to tell them that this drug can take weeks before noticeable effects. It can take about 15 to 30 minutes before bedtime to maximize sleep induction, to avoid alcohol and other central nervous system depressants, and to not abruptly stop taking this medication, because this can cause withdrawal. Some side effects are drowsiness, dizziness, and paradoxical incitement, which include insomnia, euphoria, anxiety, rage. Some nursing implications. We're going to look at a history of allergies, medical conditions, and drowsiness. We're going to obtain baseline vitals. We will not administer this drug long term because that can increase risk of side effects and withdrawal. We will take extra precautions, especially with elderly patients. And we will keep these side rails up and keep the call light within reach. We will also monitor for side effects and therapeutic effects.
Now you can more effectively care for patients prescribed diazepam.